Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
But here we are, okay. We got it together. I know
Richard didn't have his mimosa yet.
Richard will make it happen. Okay, so, why don't you introduce our guest for this half hour?
Well, today we have lovely ladies from Wilton Manors Rehabilitation Center. It's Jessica and Sherry. Okay. Hello, ladies.
Hi, good morning. Thank you for having us. Good morning.
Good to have you. It's a full house. I love it.
It is a full house.
It's a party. So, Wilton Manor is our community there in Broward, and it's a fast-growing community. And I had the pleasure of visiting you, lady, at your facility. Yes. And it takes a lot to impress me. I was very impressed.
That's a good sign.
Yeah,
great.
I was very impressed by your staff and I'm into exercise. Mm-hmm. So when I saw the training center that you guys have there, and believe it or not, so you see how small the world is. I used to be the medical director when it used to have another name under another company, and I used to be the medical director at the center.
When there was the assisted living facility attached?
Exactly. So I used to
way before my time.
both areas. We're talking about 20 years ago.
Oh, okay.
Yeah, so, and then we move on. I went to spend more time with the center. But tell me about Wilton Manors Health and Rehabilitation Center.
Wilton Manors Rehab is for short-term rehab and transition into long-term care if a resident needs that. We deal with a lot of residents, geriatric residents, that from the hospital can't quite go home right away, so they need the short-term rehab. When we dissolved the assisted living facility, we built a rapid recovery unit. The purpose of that unit is private rooms, which is quite a draw for a patient and their family, because a lot of the millennials now and the baby boomers, they find the need for customer service and more amenities for their loved ones. So we built 27 private rooms, and now we're building even more because there's such a need for it in the community. These private rooms are quite large. They're larger than my own bedroom, and they have, it's true, and they have their own bathrooms. So with that, and I've worked at other rehab centers before.
So each room had their own private bathroom?
Private bathroom. We have 2 semi-private rooms, and each part of that semi-private room is still larger than my bathroom. Mm-hmm. And you know what? Some of the reason that we have 2 semis in this rapid recovery is I've had residents that said, I'm lonely, I'd like to have company. Mm-hmm. Which is unusual to hear that, but so that we can provide that for that individual. In the rapid recovery unit, those are the short-term residents. In other rehab centers that I worked in, very often they combine short-term rehab and long-term residents in the same units. And it's not productive.
This is the typical thing that you see. That's what I was used to in the past, yeah.
We set the bar much higher for that customer service because that resident who's there for long-term care has different needs, different mentality, different emotions, different experiences than the short-term rehab that might have had a fracture, needs short-term rehab, and needs to go home. So right off the bat, that individual is getting that customized care. In the rapid recovery unit, we have our own signature gym. We have 3 gyms in the facility. One for occupational therapy, one for long-term residents, and some short-term, depending on what their needs are. But our signature is the rapid recovery gym. In that gym is a piece of equipment that's quite unique. Even acute rehab hospitals such as Memorial South Health South would give anything to have that piece of equipment. Excuse me.
Must be expensive, right? Jessica, because we call this pencil talk, and people are going to get very motivated. And, people need to know when you end up in the hospital, God forbid you end up in the hospital and you have to go to rehab, you can request where you want to go to.
Yes.
So why don't you give me the phone number and the address of, I'm going to have Jessica give us, and this is, remember, pencil talk. So write down the phone number, write down the address. If we do not motivate you, if we don't motivate you, as I was motivated when I went there, then throw it away. But I'm telling you, people, our audience going to get motivated because this is really a place to see.
Exactly.
And before Jessica does that, people can just go and call and say, I want to take a tour of the place.
Anytime.
They don't have to wait to get sick.
Never. And we
man, that's so proactive. I love that.
Yes.
Go ahead, Jessica.
We're very glad to have anybody that's interested to see our facility come and tour. And if they decide that they'd like to, they can call our Wilton Manors facility at 954-563-5711. And we'd be more than happy to answer any questions that anybody may have. Or, again, we'd love to have them to come in and
And
tour.
the location is on Andrews Avenue?
We're on Andrews Avenue. So we're 2675 North Andrews Avenue. And that's in Fort Lauderdale.
a little bit south of Oakland Park.
Right.
Yes.
So people get an idea where the location
Yes.
is. So if you end up at Broward General, FMC, Imperial Point, Holy Cross, North Broward, all of those hospitals.
We're in very close proximity. That is correct.
Even
Dr.
the Kindred Hospital.
Exactly, right. So let's go ahead. Let's talk about that.
The Alter
that
G, our signature equipment. Yes, it is a very expensive piece of equipment.
That's
why
they don't
most
have it.
facilities wouldn't even venture into that.
So I cannot have one at home.
Of
For
course,
my personal
money
use.
pays for everything. Money talks. If you want to, I'll let you know how
I
to
don't
get
think
one.
I have that time.
It's a fantastic piece of equipment.
So,
yes.
exactly.
Tell me about
and this Alter G, if you can think of a treadmill, it's called an anti-gravity treadmill. The purpose of it is anybody with at least 20% weight bearing. For instance, if somebody has an amputation in one leg or a fracture in the other leg and they have no weight-bearing status on one leg, as long as they have 20% on the other leg, you could do more productive physical therapy, occupational therapy, without any pain to those muscles, bones, and joints. Why? Because we are able to take away all the gravity and you could get to feel like an astronaut for the day. With that, your rehab potential is fast-paced because you could do more productive rehab more efficiently. And what's the ultimate goal? To get you home faster.
Get you home faster.
Exactly. So if you think of the treadmill, you stand on the treadmill, there's a suit that pulls up and zips around so that
I saw the equipment,
it's fabulous. That person then is stabilized, so there's no risk of falling. Mm-hmm. There's 4 different cameras that record biofeedback. So they're able to test the posture, the gait, the balance, and it is a most phenomenal. And I'm telling you, acute rehab would do anything to get their hands on one. So
you have specially trained personnel?
Yes, you have to have specially trained personnel, and that's the other part of it. Yeah. So we offer that, and it is for everybody. If they so choose to, we evaluate on them. And we're able to do the rehab 6 days a week for them. We also have a Biodex, which is similar to it for posture and gait. It's a magnificent gym. And in that gym, we also can provide outpatient therapy. So if a patient is done with their rehab and they go home, but they like the program and they want to continue, we have the ability to bring them back so they can continue outpatient therapy.
You know, being a geriatrician for so many years now and teaching all of the major institutions here in South Florida, one of the things that we have to deal with as providers is the fear of the patient when they have to transition from home to the hospital, hospital to rehab, and now from rehab, because rehab is not a hospital anymore. They don't see a nurse or something, so they feel like I'm just here working with the physical therapy, no nurses, nothing. And now I'm going to go home, and what do I do with my medication?
We have a solution for that. Okay. So at Wilton Manors, we are focused on the wellness of the patient, from the hospital to the rehab to home. With that said, in the rehab, during their rehab, we have a nurse practitioner. That's the eyes and ears between the resident and the physician and the patient's family or support system. That's an unusual system to have in place. We also have a full-time concierge. So that full-time concierge during the week and on the weekend is there for all of the needs of that patient. They need an extra pillow, they'd like a special meal, they need this, they need that. But our highlight also is our transitional care coordinator. So if a resident comes from the hospital to us, then that resident really is unsure of how he or she is going to manage at home. Of course, our social services department and our nursing department prepares them for their home, what's going to happen at home. We talk about home health needs. So we set up a home health provider for that resident when they go home. But then that resident still feels incomplete because they don't quite know how are they going to care for themselves when that home health agency leaves for the day. Our transitional care coordinator, which is a very unique system to have in place, follows that patient from 30 to 90 days after that patient is discharged home.
No, at home?
At home.
Wow.
She will call the patient, the family, the home health, set up the physician, the doctor's appointments. The purpose of it is to reduce that risk and that fear of going back to the hospital.
Exactly. And I remember the administrator. What was his name? The administrator.
Alexis Morpher.
Right. He's so good and he's so devoted.
Wonderful.
To
Very passionate. Very.
He sounds like the owner, but he's an administrator. But he's so into what he does. He was great. All of you guys are great.
Thank you.
Yeah.
Thank you.
But I remember he was saying only the transition coordinator will even go to the hospital before you get discharged to discuss the case with the nurses and see what medication going to be active for how long.
Exactly.
So, I like that. I like that verbal communication versus just paperwork, because we make mistakes sometimes on paperwork.
Exactly.
But when you have that coordinator going in there and picking up your case from that nurse, it's like
from
one
onset.
Nurse signing out to another nurse.
Right.
Change
We
of the
encourage
shift.
that.
That is great. That is really great.
And a lot of times I will even suggest I bring the transitional care coordinator with me before the patient is being discharged from the hospital, just to help them understand also, this is your point person, this is the person that you can contact if you need anything, if you have any concerns, once your family member is done with rehab and is going home. So another part of our wellness program is a unique, which I'm very, very proud of, since it was my brainstorm, because I'm a yogi, I'm a yoga lover. I've been doing this for 6 years. And a very unusual situation happened where I went to my yoga class one day at my gym, and I saw a sign posted that David Metz was going to be teaching yoga. Now, David Metz is Dr. David Metz, who is a renowned nephrologist and internal medicine physician. Mm-hmm. And I've known him for many years. In fact, this is such a small world, his ex-wife was my first yoga instructor ever when I moved here to Florida.
Oh, wow.
Okay. So with that said, I contacted him right away. I was so excited. And we started talking, and he had given up his private practice, and he's doing more wellness in the community. Mm-hmm. And he used to run a dialysis center in Hollywood, but he wanted to promote more wellness. So he became a yoga instructor.
Wow.
A nice little segue in his free time. And And I started a program where he does chair yoga for our residents, for their families, for our staff once a week, that we give complimentary to the residents and their family. And it has been such a huge success.
I can imagine.
Because
you are there to rehab and get better.
Exactly. To
So
feel
it's another
better.
approach.
And a different approach to the level of nursing care, because now it's taking on more of a holistic wellness
Exactly.
for the whole being, not just giving medications and doing physical therapy.
Exactly.
So we are the only facility, rehab center, that has that. And we're also introducing him to some of the local assisted living facilities, because I have been promoting this, and they are all excited to bring him on board.
Oh, wow.
So that's how I see wellness for the geriatric, and I brought this to Wilton Manors and Greystone as a company as a whole, and it's been very successful.
I can see, and I can see him teaching his classes, being a nephrologist. Okay, let's go. Drink your water. Drink your water.
Exactly.
Keep those kidneys going.
And if anybody would like to just come to take a class, please call us at Wilton Manors. Ask for me, Sherry Harris, and I will make sure that it's set up, that they can come. It's done on Thursdays at 10 o'clock every Thursday. And I'll make sure that a family member just wants to see it, wants to participate. Maybe their loved one is in the hospital and they're thinking of what rehab center to choose, and I'd be happy to help them with that.
Jessica, you know, what about if a person wants to stay home and go for outpatient therapy? Do you guys accommodate for the community
Absolutely.
with a prescription from a doctor to come and do outpatient physical therapy?
So that would be something that we could accommodate for a patient
Absolutely.
as well, as far as outpatient.
Okay.
Yes.
So
Oh,
they
we
don't
have
have
to-
to stay there. If they don't,
No, they don't have to
They
stay
can
there.
even come and do.
And they can
Correct.
do it in the main gym that we talked about. We just have to get some information from them, find out what is needed, and then we could set that up.
And
No
they
problem.
and do they need a prescription from
They would
the
need
doctor?
a prescription from the doctor. Exactly. Sometimes somebody left our facility, they recovered from a fracture, but, their knees are bothering them, their ankles are bothering them. They're not just feeling that they're strong enough, even though with time, they went home and maybe they became a little too sedentary. So they liked our program. Yes, they can call and set up the outpatient therapy.
And you are going to be arranging for Dr. Damian Ecker.
Yes, to be
He's gonna love this facility, Dr.
providing
Ecker.
physician.
Yes.
He's like
So,
7.
No, he's very excited. I have spoken to him,
Wonderful.
and he
Awesome.
heard all about it. He knows Dr. Mencia used to go there, be part of it.
Yeah.
So he can't wait to go and meet you guys.
That's wonderful.
Yeah.
That's wonderful. We're
He's
looking
so
forward
much-
to meeting him.
He's
Absolutely.
7 feet tall,
Oh,
all
wow.
muscle,
all
muscle.
muscle, yes. Oh,
I
It's
wanna
all
meet
into
him.
You'll be very
He's
thrilled
so
to
mu-
see
yeah.
our-
Very, all into exercise. So he's
I'll
gonna
make sure
love
I'll
this
give
place.
him the private tour.
Excellent. So our operation. So if the person want to come as an outpatient, can they come? No, let's go back to the a person coming, because sometimes you go to rehab and they say, no, we only do 3 days out of the week. We do 4 days.
Oh, that's a great point.
That's we have the
Wilton
capability.
Manors Rehab.
We're a preferred provider for many HMOs, besides other insurances. And we have the capability, because of the type of equipment and physical therapy capabilities, of doing rehab 6 days a week.
Excellent.
And we have the capability to do almost 3 hours of rehab a day, very similar to an acute style hospital such as Memorial South or Health South, because of our relationship, preferred provider relationship of with our insurance companies. So if an individual is able to do up to 3 hours a day, we provide that 6 days a week.
Excellent.
And we do physical therapy on the weekends and holidays. So there isn't any gap. A lot of rehab centers, a patient comes on a Friday and they're not seen until Monday.
Yes.
So if they're on an HMO plan where they have a
very short
window of time, they've already missed 3 days. That does not happen at Wilton Manors because we're designed more for that customer care service to get home faster and recover better, so they're stronger and they don't lose that time.
The key takeaways, I think, as for Greystone Healthcare overall, okay, because we also have sister facilities in the area. So we have our Wilton Manors, we have our North Beach Rehabilitation, and we also have Unity, which is in more in the South Miami area. North Beach is in North Miami Beach. But Greystone as a whole, the key takeaways, I would say, we're committed and dedicated to providing the most favorable outcomes for the patient. And offering continuity of care and communication always straight across the board as it relates to Greystone Healthcare. So just want you to keep that always in mind because we're always doing everything that we can to better the patient.
Excellent.
Well, and since this is a pencil talk,
yes,
I want everyone to remind that today we have Sherry Harris and Jessica Maglione from Wilton Manors Health and Rehabilitation Center as a guest with us.
Thank you again.
And the phone number to call the facility is 954-563-5711. And the address is 2675 North Andrews Avenue, and it's in Fort Lauderdale. Zip code is 33311.
And for our patients and family members, yesterday I was talking to a son that came from Ohio to see his 90-year-old mom. And we were talking about, going to rehab, if the mom need to go to the hospital. And I was telling them about the facility. I said, why don't you just go there and look at the facility?
Yes.
So it's important that we are a little bit more proactive. We don't have to wait for something to happen. We need to have, just like when we move into a new area, you need, if you have kids, you want to know what school I'm going to go to.
Yes.
What's the closest malls?
For the geriatric patient, is in the area that I'm going, it's not only the apartment or the condominium or the house that I'm going to get, but which hospital is close by me. Because remember, in case of an emergency, they're going to 911 you to the closest hospital, not the hospital of your choice.
That is right.
So those are things. What rehabilitation place I need to go to if the time ever come. And like you say, if you have an HMO, the window of opportunity is much shorter for rehabilitation than when you have a PPO insurance or Medicare with a secondary. Why don't you give the information about AGI if they want to call?
Yes, the AGI Medical and Dental Centers, we are open 6 days a week, Monday through Saturday. And the phone number is 954-489-1345. This is in Fort Lauderdale. And 561-270-6494 in Boynton Beach.
Excellent. Very good. Well, lady, it's a pleasure having you here.
It was a pleasure being
much.
here.
And, we have 2 minutes to talk about if I'm going to choose a rehabilitation place, why do I want Wilton Manor Health and Rehab? Health and Rehab, I like that name.
Well, it's our wellness and our customer service. And the fact that if you need transportation somewhere, you need a haircut, you need your loved one to stay with you in the private room for a short period of time, maybe not every day. We're there, and we'll give you a long white waffle robe.
Oh, yes, you didn't talk about the
spa
robe.
amenity.
And it's true, I saw the robe.
Right. Now, I've worked
really cool.
I've worked in other rehab centers before, and I used to say, you're not coming here for a spa week. You're coming here for rehab to go home.
You spoil us, man.
And now I am going to spoil you. So you get that long, white, beautiful white robe with the waffles and the name on it. And it's our pleasure to have you bring it home.
What about the food?
The food I have had no complaints
Hawaii,
about
Hawaii is
Delicious.
all about
I
food.
know, I know.
Yes.
No,
It's all about
I've had
food.
no
Healthy.
complaints about the food. I've eaten the food.
Yes.
And what we'll also do is if you have a special request, anything, our concierge will go and bring you a special meal. Whatever restaurant it is, maybe not Ruth Chris. I'm not sure about that one, but
If you have your credit card, they get it from
Exactly.
anywhere
No,
you
no.
want it.
We do that. And our administrator, executive director, Alexis Morfa, understands the importance of that customer service care. So he will do anything for you and your family between, in the right concept to make sure that care is given.
I remember a few years back, I got interviewed to be an executive medical director for a big facility right here in Boca Raton. And when I went for the interview with some of my staff members, they served us food. So we were having a lunch meeting. And we are eating, and the food was great. I said, they probably prepared this specially for us because we're having this meeting. I said, the food is really great. And I said, this is what we serve our residents.
Wonderful.
Fantastic.
And that was such I say, okay, I'm in.
Yeah.
There you go.
It's so important when you say you eat the food there, that means,
Yes.
you really stand by your product.
We stand by their product.
Excellent. Well, thank you so much,
Thank
lady.
you
It's
so
a
much,
pleasure.
Thank you so much for
Thank
having
you.
us.
Thank you
It's
for
been a
having us.
pleasure.
Okay, we'll meet next Saturday.
Thanks for listening to the wonderful world of wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.